Good morning, my dear students. Again, I am back with a very new topic and interesting topic. This is called as the male reproductive system. Okay, so moving on forward, we are going to study in detail today about the male reproductive system. Reproductive systems, these are the reproductive systems, these are there in the two sexes or the two genders, that is the reproductive system, it is different in the males and in the females. Okay, reproductive system, the function of the reproductive system, it is basically to produce the new offspring, that means the second generation of the human population. The continuity of the human race is guaranteed through this reproductive process. What the male reproductive system does, basically the male reproductive system does to produce the sperm. That means main function of the male reproductive system is to produce the sperm and deliver it to the female reproductive system. Okay, understood, my dear students? So now moving on forward. So this is a diagram. This is a diagram showing the male reproductive system. Kindly go through it very carefully. What we can see in the diagram is that we can see the ampulla, seminal vesicle, urinary bladder, symphysis pubis, ductus deferens, urethra, corpora cavernosa, penis. That means the organ through which the urine passes, the urethra, corpora spongiosum, glans penis, prepuce, testes, epididymis, ductus deferens, anus, bulbourethral gland, prostate gland, ejaculatory duct, and the scrotum. Okay, this is a diagram. Kindly go through it carefully. Moving on forward, male puberty starts at around age 12 to 13. Okay, this is a very important thing. Hormonal changes stimulate an increase in the hormonal changes stimulate an increase in the growth rate, alterations in behavior. That means the person becomes slightly more anxious. Okay, enlargement of the genitals and the appearance of secondary sexual characters such as the facial hair. Okay, because boys begin their final growth but later than girls. They have a longer period of steady growth, usually attain a greater adult height. Okay, the so the in short, the pivotal changes of the boys, they begin at a later period than the girls. Male puberty. These the following points are more important. The changes that occur are growth spurt occurs, that means an increase in the linear growth, acne, that means the pimples, larynx enlarges. Due to this, what happens? The voice deepens, facial hair appears, that means appearance of the mustache and the beard, shoulders broaden, underarm hair appears, and perspiration, that means the what we can say that the हम क्या बोल सकते हैं कि पसीना बहाना ज्यादा होता है. The perspiration increases. I hope everything is clear up till now. Moving on forward, male puberty. The muscles develop, pubic hair appears, external genitals enlarge, sperm production begins, first ejaculation occurs, long bone growth stops. The important point here is that what these points mean, it is that the secondary sexual characters, they have begin to appear and the linear growth, it is being stopped. Sperm, as in the diagram you can see that sperm is manufactured in the seminiferous tubules in the testicle. The three parts of the sperm are the head, midpiece, and the tail. Sex cells that are produced in the testes and are used to fertilize the egg or the ovum. These are called as the sperms. These are the characteristic of the male reproductive system. Sperms swim at the rate of 1 to 4 mm per minute or 60 to 240 mm per hour. 50,000 sperms are produced each minute in mature men. Kindly note down these points because these are important from your university exam point of view. Semen. What does semen mean? Semen basically means a thick fluid containing sperm and other secretions from the male genital tract or the male reproductive system. These fluids give nutrition and protection to the sperm to help them reach the egg for fertilization. Okay, I hope everything is clear. So moving on forward. Testicles or the testes. There are two pairs of testes in the male reproductive tract. These are connected by the vas deferens. Okay, male reproductive organ that makes the sperm and testosterone. That means in the testicles, singular it is the testicle, and the plural it is the testes. The testes, these are the male reproductive organ that makes the sperms and the hormone testosterone. Males begin producing 100 plus million sperms a day once they reach the puberty. Seminiferous tubules. These are tightly coiled tubes inside the testes where the sperms are being made. Okay, I hope everything is clear. So moving on forward, testosterone, this is nothing but the male sex hormone. The male sex hormone that influences the sperm production, it is nothing but the testosterone. During puberty, testosterone causes facial and body hair to grow, shoulders to broaden, and voice to deepen. That means during puberty, what are the effects of the human hormone testosterone? Again, we are saying it causes the facial and body hair to grow, shoulders to broaden, and voice to deepen. Scrotum, the skin covered sac that the testes rest in. Muscles of the scrotum help with the temperature control. Sperms develop best several degrees below 98.6 degrees Fahrenheit. Okay, so this is about the scrotum. Moving on forward, penis, the external genital organ of the male reproductive tract. The external male reproductive organ that is made up of spongy tissue that has blood flow going through it. The penis removes urine from the bladder and also delivers the sperm to the female reproductive system. The glans is the sensitive nerve ending near the tip of the penis. I hope everything is clear, my dear students. Foreskin, a piece of skin that partially covers the tip of the penis at birth. Okay, circumcision is the removal of the foreskin from the tip of the penis. It is the name of the surgical procedure. Erection, when the penis becomes hard and firm. The blood vessels in the penis fill with the blood. The penis must be erect in order for ejaculation to occur. Okay, again, I am repeating, what do we mean by erection? Erection, that means when the penis becomes hard and firm, the blood vessels in the penis fill with blood. The penis must be erect in order for ejaculation to occur. Ejaculation, when the ejaculation nothing means but that when the sperms are released from the penis. One ejaculation contains 40 to 300 million sperms. It is normal for a male to ejaculate during sleep. This is called as nocturnal emissions or the bed dreams. This point is important, or the last point is important. Again, I am repeating, When the sperm's ejaculation nothing means that it means that simply when the sperms are being released from the penis, one ejaculation contains 40 to 300 million sperms. It is normal for a male to ejaculate during sleep. This is called nocturnal emissions or the wet dreams. Urethra. Urine, urethra, it is nothing but the tube through which the urine passes. Urine passes through the urethra, a tube that starts at the bladder and ends at the opening of the penis. Sperms also pass through the urethra during ejaculation, but not at the same time as urine is carried. Okay. Epididymis. It is nothing but a coiled tube where sperm mature as they pass through. Epididymis can be up to 20 to 23 feet long. Okay, it is nothing but a coiled tube. Okay, vast difference. I hope, my dear students, everything is clear up till now. Vast difference. The next portion of a hollow tube that sperm pass through. The vast difference can be up to 12 inches long. Kindly note down these minute points because these are very much important from your MCQ final exam point of view. Vasectomy. The severing and tying of the vas difference. Once the vas difference is severed, sperm will not be able to be ejaculated out of the penis. Okay, that means the reproductive function of the of a particular male human being has been stopped. Seminal vesicles found near the base of the urinary bladder. This is the location. Okay, kindly note it down. Produce thick secretions that nourish the sperm and help the sperm move easier. Moving on forward, I hope everything is clear. The main thing, now coming on to the main part of the male reproductive system, that is nothing but the prostate gland. It encircles the urethra near the bladder. It is about the size of a walnut. It secretes a thin milky fluid that protects the sperm from acid in the female reproductive system. Moving on forward, my dear students, another thing, it is the Cowper's gland found near the urethra below the prostate. What is its function? Prior to ejaculation, these glands secretes a clear fluid that protects the sperm from acid in the male urethra. Okay, moving on forward, urinary bladder. It is nothing but a triangular sac that stores the urine before it is excreted out of the human body through the urethra. It is common both in the males and the females. I hope, my dear students, everything is clear. So moving on forward, sphincter valve. It is nothing but a small piece of skin, a muscle that holds back urine or semen so that both do not come out of the body at the same time. Prostate examination, or how the examination of the prostate is being done. An examination that is performed to identify any irregularities in the prostate gland. Exams help in early detection of the prostate cancer. Prostate cancer occurs primarily in older males and it is the second most common cancer in males in the United States of America. For every 3 men diagnosed with cancer this year, one will have prostate cancer. To rule out the prostate cancer, one important pathological investigation that is being done, it is the PSA. All the men who are about 30 years of age, they should do this investigation. The name is PSA, that means the prostate specific antigen. If PSA is found to be positive, there are chances of greater than 50% of the prostate cancer, because it is hereditary also in any family. Okay, so moving on forward, testicular examination, a self-examination that men should do and perform once per month once they have reached puberty, to detect any lumps, swelling, pain, or discomfort in the scrotum or in the abdomen. I hope everything is clear, my dear students. So moving on forward, path of the sperms. How this topic is very much important, or how the sperms they are traveling from testes to the epididymis to the vas deferens to the prostate gland to the seminal vesicle to the sphincter wall to the urethra, and then ejaculated out of the human body. Okay, understood everything? So moving on forward, this is the diagram which I had discussed earlier. All points I have discussed. Okay, kindly go through it carefully. Problems of now coming on to the problems of the male reproductive system. First is the inguinal hernia, a separation of tissue that allows part of the intestine to push into the abdominal wall near the top of the scrotum. Straining the abdominal muscles or lifting heavy objects can cause a tear in this tissue. Okay. Now, sterility, the inability to reproduce in simple language. In simple language, it means the inability to reproduce. In males, it can result from too few sperm, fewer than 20 million per milliliter of seminal fluid, or sperm of poor quality. Sterility can result from environmental hazards, including exposure to X-rays or radiation, toxic chemicals, and lead. Hormonal imbalances, certain medications, or drug use, including anabolic steroids, can damage the sperm. Some diseases, including sexually transmitted diseases and contracting mumps as an adult, also can result in sterility. Understood, my dear students? So, moving on forward, testicular cancer. Cancer that develops in the cells of the testes. Risk factors for getting testicular cancer includes undescended testicles, abnormal testicular development, anabolic steroid use, and a family history of cancer. Regular self-exams for abnormal lumps of testicles can detect an early case of cancer. Moving on forward, moving on to the last slide of this topic, prostate problems. The prostate gland can become enlarged as a result of an infection, a tumor, or age-related problems. The enlarged gland can press against the urethra, resulting in frequent and difficulty urinating. Men start to have yearly prostate exams from their physician between the age of 40 to 50 years of age. So, my dear students, in this topic, that is the male reproductive system, we have covered right from what does the male reproductive system mean, what are the problems of the male reproductive system, the individual in detail about the individual organs. Okay, what are their functions, where they are located, in short, like what the length of individual organ can be. For example, the vast difference can be up to 12 inches long. I hope whole of this topic is clear. Okay, and wishing you all the best for your exams. Thank you.